Hello, everyone. My name is Ufoma Uyibororo, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Virtual Tools for Schools and SBCs During the Pandemic. Today's webinar is the second in a three-part webinar series. Today's presentation is a SBHC provider and school partner focused webinar on the new Play to Prevent opioid misuse prevention game, currently in development with the School-Based Health Alliance. Please note that all attendees will be muted upon joining the session, and we ask that you remain muted during the presentation. There will be a question and answer session at the end, and we want to hear your questions then. At that time, you can use the chat icon that appears at the bottom of your Zoom control panel to ask questions, or use the microphone button to unmute and ask your questions verbally. Please also note that this session is being recorded and participants will receive a copy of the slides after the webinar. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students typically spend the majority of their time, in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick, expert attention, and we all know that healthy students make better learners. During the pandemic, we've heard a lot about schools being closed in a variety of ways and different barriers to access for school-based providers. However, we strongly believe that school-based healthcare is more than just the facility or physical space it exists in. It comprises a network of relationships, history of collaboration, systems of communication, and formal agreements that continue to expedite access and service provision to young people, even if the building is closed. Our webinar today will be facilitated by Katie Stinchfield, Senior Program Manager focused on behavioral health initiatives at the School-Based Health Alliance. Our speaker today is Tyra Pendergrass-Boomer from the Play to Prevent Lab at the Yale School of Medicine. Tyra brings a diverse educational background and unique work experiences to the Play to Prevent team. She received her Bachelor of Science in Biology from Howard University and her Master's of Environmental Management from Yale University. In her capacity of Associate Director for the Play to Prevent Lab at the Yale Center for Health and Learning Games, Tyra is instrumental in building and maintaining community partnerships, overseeing the day-to-day operations of the lab, and presenting the lab's research in local, national, and international settings. Tyra was a 2013 Health Foundation Health Leader Fellow. She was also a 2018-2019 Advanced Health Science Research Fellow at the Yale School of Medicine.
Thank you so much for joining today. This is Katie Stinchfield, and I will share some of our objectives for the session. We're hoping that you'll learn about the Play to Prevent Lab at the Center for Health and Learning Games, who they are, what they do. We'll do a brief review of the current games, and then learn about the newest game in development, PLAYSMART, to prevent opioid misuse in adolescents. We're going to learn how to access the current games for free, and then we'll engage in an interactive Q&A with peers to discuss implementation ideas. And we'll ask that you unmute your mics and share your video at that time. We'll also learn more about some upcoming opportunities with School-Based Health Alliance and Play to Prevent, including how you can get involved in the video game development.
All right, so thank you, Katie, for the introduction. As Euphoma mentioned, my name is Tyra Pendergrass Boomer, and I'm an associate director for the Play to Prevent Lab, and I've been a part of the team for almost 9 years now. And whenever I introduce Play to Prevent, I feel like it's always easier to show you rather than to tell you who we are and what we do. So I would like to play this brief introduction video that will give you a great overview of what we do at the lab and how we do it. At Play to Prevent,
our video games are built by teens and young adults.
For teens and young adults.
To help them live happier and healthier lives. Their voices, their stories, their visions, that's what the games are built from. It is really a collective brain, not work that can be done by any one person or any one of us. It is students, teachers, game developers, scientists. For the development of our video game interventions, everybody brings their expertise.
Community partners can range anywhere from after-school programs to schools. We always start off with focus groups with our students. From that information, we're actually able to glean what information should go into the game, storylines that would be relevant to the kids. It helps us develop different characters that might be in the game.
The greatest part about what we do is having kids design and be involved from the bottom up. They really kind of form a lot of the stories and the narrative.
We'll take the game to our game developers, we'll build out a prototype, we'll take it back to our students and say, is this relatable? Does this work?
So we're passing out headphones so you guys can be totally immersed in the game. During the gameplay sessions, we observe their reactions to the game. They're having trouble on different levels.
When they play tests, they provide feedback on what worked, what didn't work. Teens love being honest and love sharing their opinions.
I like the strategy and the competition.
In this game, you really don't have that much of a penalty, but in real life, you could lose a job, you could lose friends.
The only way that an intervention is going to have impact and meaning is if it is from their voice. A critical part of this work is being able to measure the impact. We conduct randomized controlled trials, the gold standard, and we've been able to demonstrate that our games have statistically significant impact on different outcomes that we're looking to measure. So in the short term, we're continuing to build our evidence. In the long term, the key is to really get these games out broadly.
So how did we get here? So the Play to Prevent Lab was actually established in 2009. So we've been around for almost 12 years now. And how we actually were established, our principal investigator, Dr. Lynn Feline, saw this request for proposals from the National Institutes of Child Health and Development. And they wanted to find using proven factors and risk prevention to promote protection from HIV transmission. And so she had the idea, both she and her husband, she always tells this story, had about 5 kids between them that were ages like 9 to 18 that were on some type of electronic device. And so she had the idea of submitting a proposal that would actually use a video game to address reducing HIV transmission rates in adolescents. And so what we did was we actually used this opportunity to not only address the HIV transmission rates, but as I mentioned before, any type of risky behaviors that might put a student, an adolescent at higher risk for being able to transmit HIV, but that may not have a direct correlation, so to speak. Like, again, like if you're thinking about doing drugs, that may alter an adolescent's decision ability to make sound decisions, and so that may increase their risk of transmitting HIV. Or if they're drinking, or if they're engaging in unprotected sex, we know that definitely increases the probability that they would have a high rate of HIV transmission. So we took that as an opportunity to actually address a whole bunch of different things that adolescents actually encounter in a day-to-day basis. And so we can go to the next slide. And so how we actually develop a lot of our video games is that because adolescents are at the center and the focus of them, we want to make sure that we have their voices included in the game. And so we do everything from focus groups with the adolescents to different projects that actually allow them to give us an insight into their world. And so this is an example of a project for that first game that we actually gave to adolescents. We gave them cameras. We told them to go out into their neighborhoods, take pictures of their friends, their shoes, their dress, their clothes. And so this is examples of what adolescents actually came back with. And then we were able to translate it into a game. Let's see. There we go. So these are actually the graphics that came out of the photos that the adolescents gave us. Next slide, please. Also, again, because adolescents are at the forefront of what we do, a lot of times when we're developing our games, it's an iterative process between us, the adolescents, the game developers. And so this slide just shows a great example of how many iterations we had to go through to even get a classroom scene that the adolescents gave us the thumbs up on. So if you start in the bottom left-hand corner with past 00, you can see if you go counterclockwise, you can see all the way till past 4 that those were the different stages that we went through with just even designing a classroom scene for the game. And of course, the storylines and the feedback in the the storyline and the characters in the game are of utmost importance. Even though what we develop at the Play to Prevent Lab is called serious games, which are games that are developed for a purpose other than just solely entertainment, we do want our games to be fun. We want them to be relevant and relatable to adolescents. And so we would come back to them with certain characters and different storylines. And of course, they would give us their feedback because they love to let us know things that they like and don't like. So for example, in that first picture, they told us that the clothes were too kids-like. Like if you're trying to, have a high school student character in the game, this is very kiddie. Or the one in the middle, they said he looked too old. So we had to kind of go back to the drawing board based upon like the feedback that they gave us. And so with all of those things that we do to get adolescents' voices involved in the process, this is the end result of what that was from that original request for proposals that we discussed earlier in the presentation. So this is our very first game, Play Forward Elm City Stories, and it has about 16 hours of original gameplay. So you can see that we have listed at the top 7th through 12th grade, and all of those are like the main storyline. So again, the adolescents encounter everything from situations that involve drugs, alcohol, sex, something as simple as like this first box, the right under 7th grade, is called Cheaters, and it's basically like the storyline is one of your friends didn't do their homework assignment, they want to copy yours. What do you do? Because what the game is trying to get the adolescents to understand is that decisions that they make as a 12 to 14-year-old could actually impact the rest of their lives. So they get to go down like these little story trees and see how a set of different decisions have like a certain outcome, and then the game actually forces them to make the wrong decisions first, and then they can go back in time and actually correct those and see how the outcome can change. And then at the bottom, we actually have these things called mini games, Me Power, Refusal Power, People Sense, Priority Sense, and No Sense. And what these are actual skills that we have incorporated into the game that we want the adolescent to be able to walk away with. So for example, the Refusal Power mini game actually gives them the skills to be able to negotiate out of situations where they might be pressured by their peers to do certain things. But we give them concrete skills so that they're not saying like, okay, I know peer pressure is wrong, but I don't really know how to get out of this situation and save face in front of my friends. But there are actual skills that we build into the game to allow them to practice that in a virtual environment, so that the hope is that when they actually encounter these in a real world, they'll be able to use those skills. In like many of our games, after Play Forward was actually developed, we did a randomized control trial with it to see if the game did what we thought it was going to do. So we enrolled 333 adolescents from 12 local schools and after school programs. And the kids were divided into an intervention group and a control group. And we had them answer assessment questions before they played the game, at 6 weeks, at 3 months, 6 months, 12 months, and 24 months. So needless to say, we were definitely like hunting down kids for a long time, like after they played our game. But what we were able to find with that from the game, at the 12-month follow-up period, we found that both groups actually demonstrated a low rate of initiating sexual intercourse, which was our primary outcome for the project. So that was good in a way. Like we didn't see a difference in the control versus the experimental, but our kids were not having a lot of sex at that age. But what we did find was that the sexual health knowledge was higher in those students who played our game versus the control games, and their attitudes towards their sexual health was actually higher than those who played the control game. So going on to our next game, this is actually a spin-off of the Play Forward game. It's called Smokescreen. So this one actually deals with tobacco use and vaping. So a lot of times, again, going back to when we're developing our games, we always start off with asking adolescents. So we conducted some focus groups. What we were finding from the focus groups was that I think overall as a nation, we've done a pretty good job with different campaigns like the Truth Campaign and different things like that, driving home the fact that cigarettes are bad for you. But now with this new emergence of vaping, there wasn't anything that was as strong as kind of like these generations of being able to tell different generations that cigarettes are bad for you. So what we were finding in these focus groups were that the kids were like, yeah, cigarettes are bad, other tobacco products are really bad for you, but when it comes to vaping, they're like, oh, actually that's less bad for you than cigarettes because it's just water vapor, or they have the candy flavor, so it can't be that bad, or they're colorful, so it can't be that bad. So what this game tries to do is, again, still drive home, the dangers of like those regular tobacco products that we've become so accustomed to over the last couple of decades here in this country, but also this new emergence of this vaping, and tried to get them to understand that vaping is just as dangerous, if not at most of the time more dangerous, because like those little cartridges are equivalent to a pack of cigarettes, and kids are downing those things in like 15 minutes. So getting them to understand kind of like that, the harms that come along with this new age vaping. So this is the game Smokescreen. And next slide, please. And this is just some screenshots from the game. So, you're trying to navigate different situations where, some students or some friends of yours might be engaged in some of these behaviors, either vaping or smoking or something like that. And so you're trying to navigate your way through that, that very complex middle school and high school web of being social, but knowing the signs of like, when someone might be addicted to these products and may not know, and being able to navigate your way through those different situations. And as I said, with all of our games, they are put to a test, some type of test, just so that we're not like, hey, we have these great games and the kids say they love it, but making sure that the games are actually doing what we say they're going to do. So we actually worked with a group out of the University of Southern California, and we enrolled almost 600 kids and had them take pre-test and post-test after they played the Smokescreen game. And we were really happy to see that there was a change in like how students perceive the risk of e-cigarettes, and then also there was an increase in negative health beliefs around cigarettes and e-cigarettes. So before they might have thought, e-cigarettes aren't that bad, but then after playing the game, they're like, oh, okay, like, they are, I better pay attention to this, they are kind of dangerous. So we were happy to see the results of that particular project. And then finally, of our 3 games that already exist and have been tested is Playtest. So Playtest is actually, again, a spin-off of the original Play Forward game, but this one is actually geared towards slightly higher age adolescents, high school age. And the goal is to actually get them to utilize their school-based health centers to get tested for STIs and HIV. And so this was a really interesting project because what we were able to do was not only work with the school, but work with the school-based health center and their staff to actually track students to see if they actually came in to get tested for STIs and HIV as after they played our game. And so this project actually wrapped up basically as everything was shutting down last year for COVID. And so right now we are in the data analysis phase for that project and hope to have some data on that within the next month so that we can see how our large randomized controlled trial went. We had almost 300 students participate in that project to test out this game. And then these are just screenshots from that game. So as you can see, home screen, very similar to Play Forward. It's a little bit, shorter with regards to how many storylines that are in there, but there are, again, still skills that we want the students to walk away from. One of the big skills that we actually included in this game was being able to advocate for your personal health. So like we have a conversation that the students have to practice in the game with a healthcare professional, being able to articulate their needs, being able to take in the information that the healthcare professional is giving to them. And so we actually had APRNs that worked at school-based health centers that helped us develop the dialogue for that particular interaction in the game. And just as a recap, all the 3 games that I just mentioned are available for free. So if you're interested in using them in your school or your school-based health center, this is how you can actually get in touch with us to get free access to it. We give out as many user IDs and passwords as you need, and you could just have at it with implementing it however you feel. And so now we're actually going to transition to the main topic of this particular presentation, and that is our current project, PLAYSMART. So we were very fortunate that in September of 2019, we were awarded a grant through the National Institutes of Health, their HEAL initiative. And what HEAL stands for is helping to end addiction long term. And so we all know this, the statistics that are coming out with regards to how prevalent opioid misuse is in all of these different areas of the countries, these different demographics, and it really has become a nationwide epidemic. So the HEAL project actually has 10 sites across the US that kind of have like their areas of specialty of like what target population that they're working with. And so because our name, the name of our game is adolescents, we actually spent the last year developing an opioid misuse prevention video game. Next slide, please. Again, how we developed the video game, we had focus groups. Adolescents' voices were at the forefront of that, making sure that we incorporated a whole bunch of different things into this new game, because we do understand that there is a lack of knowledge specifically about what opioids are in general, and then how people can get elevated to the point of where they are misusing them and what misuse looks like. So an example of some things that the adolescents told us from the focus groups. One kid says, well, I think a lot of people know like certain drugs are obviously bad, but you learn that these are drugs and these are bad, but they really don't break them down into these are the categories of drugs and what falls under each category. So a lot of people know the names, but they won't know what category they're under. And that was in response to us asking them, the students, like, were they familiar with opioids? The simple question, do they know what opioids are? We had another student say, me personally, the first opioid I learned about was Percocet. I learned that it comes in the different milligrams. Basically, you got 5s, 10s, and you got 30s. And some people, if they start taking 5s, their bodies get used to that. So they'll do 2 5s and a 10, or they'll do 2 10s and a 30, and basically balance it out. And once you start off a 1 and that one doesn't work for you no more, it's just a gateway to another opioid. So these are out of the mouths of teens about like, you know, their experiences with interacting with opioids. So we could see that, you know, it runs the gamut of like some students being like, I know a little bit, or I think I know a little bit. And then you have some students that are very well versed in it, and they even start getting into that notion of basically addiction, to where it's a gateway to another opioid because they've been using this and it no longer works. In addition to the adolescents and school-based health center affiliates focus groups, we also did interviews. So we did interviews with those who were in recovery from opioid misuse disorder, and we also had the opportunity to do interviews with treatment providers of opioid misuse disorders. And so we got a nice broad range of voices as we were building out the storyline and content for this game. So this excerpt that just came up is actually from an individual that was in recovery from opioid misuse disorder. So basically he stated that he started using drugs because it made him feel happy and he liked being in control of the way he felt. And he transitioned from cocaine to opioids, specifically heroin, because he was doing a lot of cocaine, staying up to 3 a.m. every night and wasn't able to fall asleep. And he needed a downer to get to bed. So his sister's boyfriend offered him a downer to help him sleep. And at the time he didn't know what it was when he smoked it, but it ended up being fentanyl. And so that interviewee described his first time using heroin, an opioid, as immediately feeling like he was being hugged by a blanket. And from there he became addicted to opioids, and his reason was that he kept going back to opioids to quote unquote get better and not experience those symptoms of withdrawal. So one of the things that we wanted to make sure that we did with this game is, again, this is from the voice of an individual who is currently in recovery from opioid misuse disorder. And we wanted to make sure that, like, you know, we gave them the opportunity to say, like, you know, if you had to tell younger students or, you know, your younger self something, how did you get started in this and what would be the advice that you would give them? And so that gave us a lot of insight into different scenarios of like how students could be, you know, introduced to opioids, and then how that misuse kind of like elevates itself. And so with this particular project, we're working with 16 to 19 year olds, so a little more mature population. So we wanted to, again, make sure that anything that we developed was relevant and relatable, and it was like age appropriate. So 16 to 19 year olds, we can kind of like, you know, start grappling with some of these things that are mentioned in this excerpt because they're kind of that, you know, that older age. All right. And as I mentioned before, we use those interviews, we use those, you know, those focus groups to develop storylines, content, and art for this new game, PLAYSMART. And again, our team was extremely lucky that like this last year, as we've been in COVID lockdown and working remotely, has been mainly about game development, but it's a very intense process. And, you know, Katie can attest to it as well. Having 2 to 3 meetings a week to literally like comb through, making sure that what we're saying is correct, making sure that, you know, we're not using stigmatizing language, making sure that storylines make sense. So again, the game is set up to where students get to go, you know, basically down like these decision trees and see how like certain decisions have certain outcomes, and then go back in time and make different decisions to see how those have different outcomes. So basically making sure that all the storylines are consistent and they make sense. And then also kind of like, you know, the mini games, what do we want the mini games to look like? This project gave us the opportunity to update a couple of things. So you'll see down in this bottom right picture, it's basically like the face of an iPhone. Like a lot of our kids, you know, if not majority of them, have like, you know, some type of cell phone that they're literally like glued to all the time. And so we wanted to incorporate that into the game. So these are just, you know, some screenshots from the game. And so now I would actually like to share, this is, yep, that was the actual home screen, but I would like to share now, play through about 2 minutes of the game so you can kind of see like what the final product looks like. And give me 1 second, I'm going to switch computers. All right, so we have our nice little music here. But again, this is the home screen of the game. And so I'm just gonna click, and these are the 6 storylines, and then these are the mini games on the side. So I'm just gonna click on one and we'll see what happens. So this says, this was supposed to be a low-key party, nothing special.
Ow, my head. Where am I? What happened last night? There was a party, a crazy party.
Hey, you made it just in time. You gotta try this new drink my older cuz showed me.
Okay, so we have cutscenes that are included, and then what the player has to actually do now is navigate through this story and find different key points that will give them information to make better decisions. So we'll click on him. And they get a key point. So he's saying this stuff is where it's at. It'll make you feel great, just like that music video. So in this cup is lean, and I don't know, like lean, back in my day they called it scissor. It is a mix of like codeine and like Jolly Rancher candy that's mixed in like this cup, and a lot of times they have that at the party. We learned that directly from the students, and so like getting them to understand that that codeine in itself that's included in that cough syrup is actually a form like of an opioid is one of the things that we built into this storyline. Another thing that we also did hear from the students is where they learn about these things, the opioids. A lot of times, just like with everything else, media is a big thing. So when this particular character is saying like, okay, like drink this stuff, it'll make you feel great, just like in that music video, that came directly from the students as well, where you have these music videos, they show people, celebrities having a good time using this stuff, and that is the perception that they end up getting, like, oh, like this stuff is fun. So this is part of the purpose of the game is to dispel that myth. So we got our key point. We'll go to the timeline. So again, we're going down this path down here of these decisions that we made the night before that didn't have great consequences, because we saw that in the opening scene, the character couldn't remember what happened. They're in their bed from a hangover.
I think I'm gonna be sick.
Good stuff, right?
What else happened? How did I get back home? I don't remember any of it.
Okay, so again, you're learning from the cutscenes, and then like having to read these text boxes and piece the puzzle together of like what happened the night before. And so what's actually going to happen is, again, like they'll get these key points, and then they'll actually have the opportunity to go back in time and make better decisions. So we'll see one more scene, and then I'll cut back to the presentation.
I can't remember anything else. What? It's so early.
You better watch your tone. Be downstairs in 5 minutes.
Mom must have caught me getting back. This can't be happening.
Okay, so again, they're trying to figure out the pieces of the puzzle of what happened the night before. And as they're going through this game, as they're finding these key points, they will find out different things, actual facts about what they might have been drinking that night, what was happening at that party. And again, they'll actually be able to go back in time and make better decisions and see how the outcome is different. So that was just kind of like a little introductory thing to the game. So I'm going to stop sharing my screen. All right, and then back to this computer. All right, so with all that being said, where we currently are with this game now is that we will actually be starting a pilot study next week with a group of 30 students. We're actually working with 2 of our longtime standing partners, and we're going to have 30 students play different levels of the game. And again, this is going to give them an opportunity to give us some feedback on things that they like, things that they don't like. And then what's going to happen is that for the months of June and part of July, July, we're going to send this feedback back to our game developers, and they're going to make some tweaks to the game, and that'll be like the final game. And then what's going to happen in September 2021 when we all come back to schools, and not sure what that's going to look like yet, but beginning of next school year, we will actually be beginning our large-scale randomized controlled trial, where we will be working with 10 to 15 schools that have school-based health centers across the state of Connecticut, and our goal is to enroll 532 students to actually test out this game. So we've done a lot, but we're only halfway through the project, because now, as I said, we don't want to just put games out there that we're like, oh, we think this game works, or like the kids said they enjoyed it, so here it is, and we hope that it works. No, we actually have the onus of being able to say what this game is and isn't able to do. And that's what we're hoping to get by, having this large scale randomized control trial and get that type of data. So the students will actually be taking assessment, like answering assessment questions before they play the game, at 3 months after they play the game, 6 months, and then 12 months after they play the game. So we'll be able to see like if they learned anything from the game, and if they did, like how long did they remember that, like a year from now after they played that game at that 12-month time point, do they still remember that heroin is classified as an opioid? And then we're also going to measure things like their attitudes. Their, like right now, their attitudes towards opioids might be like, oh yeah, they're totally safe because they're prescribed to you from, doctors most of the time. But our intention with the game is to actually get them to understand that yes, like they are safe when used correctly, but when you're doing things like misusing them, like taking someone else's that are not prescribed for you, or taking them in a way that then other than what is prescribed for you, then that constitutes as misuse. And when you're misusing opioids, they can be just as dangerous as other types of drugs that they might be more familiar with. So we're going to measure their attitudes. We're going to measure their self-efficacy, like if they're put in certain situations, and let's say that one of their friends is offering them some of their prescription opioids, will they now know after playing our game that they should be able to say no to that? Like how certain are they that they could say no if they were put in that situation where their friend is offering to share their opioids with them in some capacity? So we're going to measure a whole bunch of different things during this randomized control trial, and then analyze the data. And then one of the other things that we will also do, next slide please, is that after the randomized control trial is done, a lot of our games, as mentioned before with the other 3 games that we highlighted, are simply just put onto our website and people can get free access to it. Luckily, with the HEAL grant, there is money built into the grant to actually see how these interventions work in the real world. So the implementation of the game. And so what we would be looking for after the randomized control trial is 15 high schools from across the nation who find, that this is a very useful tool that they might be able to use in their schools and their school-based health centers. And we would like to work with them to see like, okay, here's the game, you implement it however you want to, and then give us feedback on what you did, things that might need to be changed or improved, things that worked, that didn't work. And we want to get that feedback from the schools that implemented the game. So there are opportunities for people on this call. If you're associated with a school in Connecticut or a school nationwide, there are opportunities to get involved with this project. And these are the opportunities. So again, if you are in the state of Connecticut and you work at a high school and your school has a school-based health center and you would like to be part of the randomized control trial. So one of the things that I did want to mention, because it is a research study, like we're the fun people that always come in. The kids are like, oh, the video game people are here, because all they see is the fact that they're playing a video game. We bring snacks, so like you feed high school students experience, they're good to go. But they are actually, you know, helping us, and they're in a research project. So with regards to that, because they are part of the research, they will get gift cards. So for this project, over the course of those different time points that they're answering the assessment question, those students could get $135 in, we've decided now, Amazon gift cards. We usually give Visa gift cards, but it's gotten a lot easier to send stuff electronically with Amazon gift cards. So they get that for, you know, for participating in the project. And of course, to participate, they have to have like parental consent. So we have like all of that stuff, you know, those IRB documents that, you know, we send home and have them sign before they participate. So that's the randomized controlled trial. So if you're in Connecticut and your high school has a school-based health center, and this is something that you would be interested in, my email address is tyra.pendergrass@yale.edu. So please send me an email. I would love to hear from you. And then if you're not in the state of Connecticut, but feel like you might be able to use this in some way outside of a research project. So actually, like if you have a student that, you know, that you feel may be at risk for misusing opioids, and this is the type of intervention that you feel like you might be want to implement, we are looking for 15 sites nationally that would want to try it out and see how they can implement it in a real world setting. And so the contact for that is Erin Sullivan, so E. Sullivan at SBH4all.org if you're interested. And that is the end of my presentation. I thank everyone so much for your time today.
Thank you so much, Tyra. As Tyra said, we are actively recruiting for these two opportunities. So please reach out. We would love to have you participate in the randomized controlled trial if you're in Connecticut, and then the nationwide implementation project. You don't have to have a formal plan for that. We'd help you build a plan around how you want to use that in your setting. So really happy to talk with you about that. And again, there are financial incentives for participating. So please reach out. We'll do Q&A with Tyra in a moment. I wanted to share one more opportunity. Our final video game in this series is specifically going to be designed for youth. So if youth are interested in learning about these video games, we'll cover all 4 in our next webinar on April 7th. So the link is here on the slide, and you'll get a copy of these slides after our session today. So now in a moment, I'll stop sharing my screen, and we'll invite you to engage in our interactive Q&A. Hopefully you can turn your video on, and I'll have a series of questions, so you can either unmute your mic to speak or type responses in the chat. And as always, please remain muted if you're not speaking. So here are the questions we'll ask today. Again, I'll stop sharing my screen in a minute, but we'll repost each question in the chat as they come up in case you forget. So first questions, any general questions regarding Tyra's presentation? Tyra, there was one in the chat earlier where they were asking about prevention of prescription use, and I wondered if it was discussed, but it sounds like you already covered it in the presentation. So I don't know if you want to address that anymore.
Yeah, that was from me. I'm Della Lisi Kerr in Orange County, California, from the Behavioral Health Services, specifically Alcohol and Drug Education and Prevention team. Wow. Thanks, Tyra. I was on your previous presentation and really love Play to Prevent. Love this idea, but we're concerned that some of the opioid specific options that are available, for whatever, I can't think of a better word for it, but are too, excuse the expression, heroin focused. And while we're painfully aware of the risk of fentanyl, what we're seeing out here are a lot of youth simply not using their medications the way they are prescribed, or recognizing that they don't need as many of them and selling them. And all of those are the risks we would like in a Play to Prevent game. But then the very moment I was typing it, you mentioned it. You said that part of the game provides for those kind of options, not just, I mean, let's face it, prescription drugs are something some of us need, and we as the Prescription Abuse Prevention Initiative want to make sure people get them and take them correctly. And we want to make sure that grandma and grandpa don't get theirs stolen and sold somewhere. So I wanted to know if you addressed that, and you did. So thank you so much. I would love it if we could be part of the nationwide it's too early in the morning for me. I can't think, but we would love to be a part of that. So I'll contact Erin Sullivan at some other time. Thank you so much for your time and attention. I'll mute my.
Thank you so much, Della. And I'm writing your name down because I'm going to make sure you reach out. Awesome. Any other questions for Tyra? General questions. Again, if you could share your video, that would be great. It's a little more interesting than talking to your name on the screen. But any questions, you can either unmute and ask or put it in the chat. All right, I'm going to move to my next question for this group. General ways that you could see using these games in the school or school-based health center setting. Just ideas off the top of your head based on your experience.
I'll chime in. I was thinking about, anyway, of course, it would work with any of our students, but I work at a career and technical education center, and specifically with our students that are in, we call it game design, but simulation and animation design program. They create programs similar to this, but it will be a good model and maybe an inspiration for them to see what someone else has already developed and participate in it, and maybe duplicate or create something or add to a program just like it. So I think that would be good for them to participate.
Yeah, and I think that's something that we haven't necessarily thought about, kind of like the opposite side of that, like the game, those students who are interested in like the game development aspect of it, because as I mentioned before, our games are classified as what they call serious games. So we're not educational games, and then we're not, the stuff that they play on Xbox and things like that. Serious games are games that are developed for a purpose other than just entertainment. And that's not to say that they aren't entertaining, they aren't fun, but again, we are trying to impart knowledge in students. We are trying to get them to practice certain behavioral skills, and so that is the goal of our games. But one of the interesting things is, like, when we each year we have summer interns that actually, work with us and different things like that. So number one, that's an opportunity if they're interested. And then number two, we actually give the students a task that is due at the end of their 4-6 weeks with us, where they have to develop their own serious game. And not saying they have to go as extensively as like coding it, but they can put together like a PowerPoint. What is an issue that you want to address, and you think that a game would be useful for teaching, like, students your age? And to see what the students come up with is so amazing. Like, we've had students that have created games on like immigration, on bullying, on the environment. So like, to see things that are important to them, where they feel like, oh, okay, I want to teach my my peers about ABCD, and a game could be useful to be able to do that. So yeah, those game development students, that is initially what came to my mind when you said that. Maybe they could, an assignment for them could be to develop their own serious game.
Well, some of our students, they participated in a congressional app challenge, and they created a mental health app. So it was, their targeted audience were their peers, so high school students. So actually, they actually won with that particular app this school year. So actually what students would do is, if they felt like they needed to get help, they would actually sign into the app and say what their concerns were. And then there were numbers or, you know, people that they could reach out to with that. So it is a serious app. It's not necessarily like an Xbox or, you know, those type games. It's serious. So it's in that same, you know, interest.
Yeah, that's amazing. And I think that's you know, a perfect example right there of like why we include adolescents at every step of our process, because clearly they were able to see a need with their peers and, you know, even things that they might experience and develop a solution for it. That is great.
Yeah, I love it. And I love how it gets at sort of different groups of students. Maybe you have a student who's interested in being a doctor. They're interested in the disease prevention, health promotion aspect of the content of these games. But then we also have a lot of students who are interested maybe in that game design aspect and just different ways we can reach students. Is something that I love about these video games. I think they have lots of applications for a wide variety of students. I'm going to hop to our next question because I know we're getting close to time. When you think about school and school-based health center collaboration, obviously we need to facilitate that buy-in to get the games into schools. What are some ways that you get staff and student buy-in to services or projects to get them interested in using a game like this or a program like this?
Okay, I didn't want to hog the time, but since it's silent, I was thinking about the student leaders, and it doesn't necessarily have to be the student body president or whatever. Sometimes it's the athletes, like the head of the teams, people that students look up to. So I would say the leaders in the school, you know, those people who are already out there and, you know, students are already attracted or interested in being with that group of people, getting those people interested or engaged in the project, and they can actually be your advocates for participation.
I love that. We are all about youth development at the Alliance, and I know obviously Play to Prevent Lab also really seeing the value in youth voices and leading initiatives like this. So cool. Others have thoughts about ways that you can get that kind of collaboration with students and or school staff?
Pretty much the same way. I would think we have these professional learning communities, or, you know, the lead teacher or whoever introduce the project and actually sell it for you, and not necessarily seen as something else that they have to add to all the other things that they're doing, and promote the incentive that the students are getting, and possibly think of a way to incentivize the teachers too, you know, for their students participating. And it doesn't necessarily have to be a gift card, maybe a free lunch, or, you know, somewhere where they don't have to participate in duty, you know, different things to incentivize participation.
I love that. Food is magical.
It actually is, in chocolate.
Yeah. I also see Megan in the chat said, if the game is aligned to any academic standards, this helps with getting schools to implement, and knowing that the game development process included students and youth is a big selling point. And that is a great segue, Megan. We do have, after our last webinar, Tyra put together a document that helped align some of the games to health standards. So again, if you've got a health teacher that's interested, then that might be helpful in getting them on board to test out the game in their setting.
I was just going to add, I'm here in Mississippi. I apologize, Jenny.
No, my apologies. I have to run to teach class, but as a health teacher, I'm looking at this and thinking, oh my goodness, this could be invaluable for some of our kids. So as a health teacher, I'd be very receptive, but I apologize. I need to go teach.
Yeah, Jenny, thank you so much. I really appreciate that. I had the same thought. So feel free to reach out. We're happy to share anything we can to support you.
Thank you.
I just wanted to add, I'm here in Mississippi, and so they're from our State Board of Education, we're implementing the social emotional learning standards for the state. And so that would be a way to align it to standards. So everyone has to participate in that. So I think that would be something additional that we could add in there, you know, in our arsenal.
I like that. That's a great point. I'm going to wrap up because I know we have a couple more announcements before we end, and we're short on time. If anyone has any other questions for the School-Based Health Alliance or Play to Prevent, Tyra, we're happy to answer them. Again, we really want to support you using these games to the best of your ability in a variety of settings, and that can look a lot of different ways. So please do reach out if you'd like to connect and participate in any of those opportunities that we shared already, the nationwide implementation study, the randomized controlled trial in Connecticut. Please let us know. A couple other opportunities coming up. We have our School-Based Health Alliance Spring and Summer Education Series in place of our in-person convention. If you're used to coming to see us in person in June every year, we will not have an in-person convention, but we will have this Spring and Summer Education Series. And there's more information in the link on this slide. Our youth development going strong as always. We have a digest and a survey you can participate in. That group's next webinar will be on utilizing media to talk about unhealthy relationships with young people coming up in May. And we also have our Be the Change Youth Leadership Training Program that'll be virtual this year. So we really encourage you, if you have youth who are interested, to sign up for that. You can participate virtually. So all across the country, it's a great opportunity. And here is our contact information. If you'd like to reach out, again, myself, Katie Stinchfield, Tyra's information is there. And then the slides will also include information for Erin Sullivan, who will be leading our implementation trial. So thank you all for joining us today. We'll be in touch via email with the slides and recording link. And we're so grateful to you for joining.
Thanks, everyone.